Hi, I'm Andy. I'm one of the pharmacists at the Great Yarmouth store. I'm here today to talk to you a little bit about NMS, the new medication service. We're going to be going over all parts of the service and what you can do to help us.
The New Medicine Service, NMS, is a service we provide for patients starting a new medication for one of the conditions listed on your screen now. People often have problems when they start a new medication. NMS allows us to support those patients with any problems they may face in those initial weeks. Our aim is to help patients take their medication safely and more effectively. This in turn results in savings for the NHS, whilst improving our patients' quality of life. The service is made of three main stages. So initially you have the engagement stage, which is when we speak to the patient before they start taking their medication. We'll see if they're eligible for NMS and ask if they're interested in the service. Obtain their written consent and agree on the best way we can contact them. This can be on the phone or in person. The intervention stage is 1 to 2 weeks after starting a new medication. The pharmacist will speak to the patient about how they take their medicine and identify any barriers which prevent them from taking it. This is where the pharmacist can give their advice to the patient, and if anything serious has come up, they can be referred to the GP. Now if they're going to continue with that medication, they will agree a time for the follow-up stage. Now the follow-up stage is 2 to 3 weeks after the intervention stage. It's a similar conversation to the intervention stage, but the pharmacist will follow up any prior issues. They'll reinforce the benefits of the medicine and ensure it's being taken as prescribed. Again, if at any point there are any issues that have arisen, they can be referred to the GP. The engagement stage is where you can really help us. Identifying and signing patients up for NMS can be undertaken by anyone in the pharmacy. Every time you sign a patient up for NMS, you give them the best possible chance of getting the most benefit from that medicine. So to help demonstrate this, we'll be following Rob. He's been prescribed a new inhaler for his asthma.
Hey, you're right.
So when Rob hands in a prescription, we'll ask him one simple question. Are any of these medications new for you? In this case, Rob has a new inhaler, so we'll place a small star to the right hand side of the new drug. This highlights to the pharmacist what medicines are new. To give you a better idea of what medication is eligible for NMS, let's go to the dispensary.
Here's some medication you might see under NMS. So you're looking for inhalers, that will be used for asthma or COPD. You've got your blood pressure medication there, your antiplatelets or your anticoagulation medication, and finally medication used for diabetes. Doesn't matter if you don't know all the medication under NMS, but it's great if you can know some.
Now Rob's been prescribed a new salbutamol inhaler. This medication is eligible for NMS, so we'll check if he's using it for a target condition.
Are you taking it for asthma at all?
Yeah.
Okay.
So after confirming medicine is for a target condition, and that's within NMS, you can sign them up.
If you've got any questions, you can let us know. Any side effects?
Now ensure you explain the consent form to the patient, and you can speak to your pharmacy manager for a more detailed explanation of this.
Which just does need your consent really. Firstly, so if there's any issues with medication, I can contact your GP on your behalf, part and service.
Now if they're happy to continue, ensure they sign and date the form and confirm their phone number or agree on a good time to come into the pharmacy. But what if you haven't seen the patient? If you're labelling their medication, a quick glance at their records may indicate if it's new. If you think it is, start the medication on the prescription and add a consent form to the basket if you think it might be an NMS. Now when the pharmacist hands out the medication, they'll be able to confirm if the patient is eligible to take part in the new medicine service. Now Rob hasn't used this medication before, so the pharmacist will discuss with him things like benefits and side effects. And then in 1 to 2 weeks time, we'll give him a call and see how he's getting along. Something as simple as a phone call can make a huge difference to someone's health. Now Rob's asthma is under far better control thanks to NMS. Turns out he wasn't using his inhaler as intended, but thanks to the new medicine service, he's making far greater gains from his medication. But Rob's not alone. Data shows that nearly 1 in 5 patients aren't taking their medication as prescribed at the intervention stage. Thanks to the new medicine service, by the follow-up stage, 2 to 3 weeks later, this number reduces to nearly 1 in 10. We want to be able to support as many patients like Rob as we can, as they start their own journey with a new medicine. Every patient we identify and sign up for NMS is a step towards ensuring our patients are receiving the best healthcare possible. We do it because we care, and it all starts by asking one simple question.